Deep vein thrombosis. The best treatment options. There are both superficial and deep veins in the limbs or extremities. A blood clot in the deep veins is a concern because it can be dangerous. A blood clot in the deep venous system of the leg becomes dangerous when a piece of the blood clot breaks off, travels downstream through the heart into the pulmonary circulation system, and becomes lodged in the lung. A tendency to form blood clots can occur when people are immobile, have a blood tendency toward clotting, or have injury to veins or their adjacent tissues. Symptoms of deep vein thrombosis include pain, swelling, warmth, tenderness, and redness of the leg or arm. The diagnosis of DVT can be suggested by blood tests and confirmed by ultrasound or other imaging tests. Treatment of DVT typically involves blood-thinning medications unless they cannot be used in a patient. In that situation, an inferior vena cava filter is potentially considered. Complications of DVT include pulmonary embolism and post-phlebitic syndrome. There are other types of thrombosis such as cerebral venous thrombosis, CVT, portal vein thrombosis, and cavernous sinus thrombosis. A deep vein thrombosis describes a blood clot that forms in the deep veins located in the arm or leg. It is important to know the body's anatomy and function to understand why clots form in veins and why they can be dangerous. Arteries have thin muscles within their walls to be able to withstand the pressure of the heart pumping blood to the far reaches of the body. Causes of deep vein thrombosis. Blood is meant to flow. If it becomes stagnant, there is a potential for it to clot. The blood in veins constantly forms microscopic clots that are routinely broken down by the body. If the balance of clot formation and resolution is altered, significant clotting can occur. A thrombus can form if one or a combination of the following situations is present. Immobility. Prolonged travel and sitting, such as long airplane flights, economy class syndrome, car, or train travel. Hospitalization. Surgery. Trauma to the lower leg with or without surgery or casting. Pregnancy, including 6-8 weeks postpartum. Obesity. Hypercoagulability. Medications such as birth control pills, for example, orthonovim, Yaz, Yasmin, microgestin, Kellner, and other estrogens. Smoking. Genetic predisposition. Polycythemia. Cancer. Trauma to the vein. Fracture to the leg or arm. Bruised leg or arm. Complication of an invasive procedure of the vein. Symptoms of deep vein thrombosis. Superficial thrombophlebitis symptoms. Blood clots in the superficial vein system most often occur due to trauma to the vein, which causes a small blood clot to form. Inflammation of the vein and surrounding skin causes the symptoms of any other type of inflammation, including redness, warmth, tenderness, and swelling. Often the affected vein can be palpated as a firm, thickened cord. There may be inflammation that follows the course of part of the vein. Although there is inflammation, there is no infection. Varicosities can predispose to superficial thrombophlebitis and varicose veins. This occurs when the valves of the larger veins in the superficial system fail, allowing blood to back up and cause the veins to swell and become distorted or tortuous. The valves fail when veins lose their elasticity and stretch. This can be due to age, prolonged standing, obesity, pregnancy, and genetic factors. Deep venous thrombosis symptoms. The symptoms of deep vein thrombosis are related to obstruction of blood returning to the heart and causing a backup of blood in the leg. Classically, symptoms include pain, swelling, warmth, and redness. Not all of these symptoms have to occur. One, all, or none may be present with a deep vein thrombosis. The symptoms may mimic an infection or cellulitis of the leg. Medical care for deep vein thrombosis. The diagnosis of a superficial or deep thrombosis often relies on the clinical skill of the healthcare professional. Diagnostic tests need to be tailored to each situation. Swelling, redness, and pain may be indicators of a blood clot and should not be ignored. These symptoms may be due to other causes, but it may be difficult to make the diagnosis without seeking medical advice. If there is associated chest pain or shortness of breath, further concern exists that a pulmonary embolus may be the cause. Once again, seeking immediate medical advice is appropriate. Doctor treats patients with a swollen extremity or concern that a DVT exists may be cared for by a variety of healthcare professionals. Both the primary care provider and a healthcare professional at an urgent care clinic or emergency department are able to recognize and diagnose a DVT. Some patients have their diagnosis made when they are in the hospital. Treatment is usually started by the doctor who makes the diagnosis, and long-term follow-up may be done by the primary provider. Depending upon the situation, a hematologist may be consulted. If there is need for the clot to be removed or dissolved, an interventional radiologist may also be involved. Depending upon the medication used to anticoagulate the blood, pharmacists and anticoagulation nurses may also be involved on the patient's treatment. Deep vein thrombosis diagnosed. The diagnosis of superficial thrombophlebitis is often made by the healthcare professional at the bedside of the patient, based upon the physical examination. DVT usually is diagnosed with ultrasound. Ultrasound is now the standard method of diagnosing the presence of a deep vein thrombosis. The ultrasound technician may be able to determine whether a clot exists, where it is located in the leg, and how large it is. Ultrasounds can be compared over time to see whether a clot has grown or resolved. Ultrasound is better at seeing the veins above the knee as compared to the small veins below the knee joint. Other tests for DVT. Venography, injecting dye into the veins to look for a thrombus, is not usually performed anymore and has become more of a historical footnote. Other blood testing may be considered based on the potential cause for the deep vein thrombosis. Treatment for deep vein thrombosis. Treatment for superficial blood clots is symptomatic with warm compresses, leg compression, and anti-inflammatory medications such as ibuprofen. If the thrombophlebitis occurs near the groin where the superficial and deep systems join together, there is potential that the thrombus could extend into the deep venous system. These patients may require anticoagulation or blood thinning therapy. Deep venous thrombosis treatment. The recommended length of treatment for an uncomplicated DVT is 3 months. Depending upon the patient's situation, a longer duration of anticoagulation may be required. The treatment for deep venous thrombosis is anticoagulation or thinning the blood with medications. Surgery for deep vein thrombosis. Surgery is a rare option in treating large deep venous thrombosis of the leg in patients who cannot take blood thinners or who have developed recurrent blood clots while on anticoagulant medications. The surgery is usually accompanied by placing an IVC filter to prevent future clots from embolizing to the lung. Phlegmasia cerulea dolens describes a situation in which a blood clot forms in the iliac vein of the pelvis and the femoral vein of the leg, obstructing almost all blood return and compromising blood supply to the leg. In this case, surgery may be considered to remove the clot, but the patient will also require anticoagulant medications. Stents may also be required to keep a vein open and prevent clotting.